Well, Bill, one of the big things we've been getting calls about are issues and wait times with the call center, but the health district says they are working to fix those, but at the same time, they have launched a new online portal as another way for people to sign up to get on the waiting list. But talking with those who have been facing these struggles, they say it's been inexcusable.
I don't think they have their acts together yet.
Patty Merchant gives his thoughts on the vaccine rollout in the Chesterfield Health District after trying without success to sign up on their call center Monday. He says at first he was just getting busy signals.
After trying several times, I finally got through, and there was a recording. It put me on hold.
Merchant says after waiting several hours without talking to anyone, he finally gave up. He says his wife finally had success Tuesday, but adds it shouldn't be this difficult.
3 hours and no phone call. That's absolutely ridiculous. That's inexcusable.
Tuesday, Chesterfield Health District Director Dr. Alexander Samuel says when they moved into Phase 1B, the call center was quickly overwhelmed, and he's incredibly sad at the service they've been able to provide.
We've added more people, have been working through some technical challenges with, the technology at the call center.
And Samuel says they've also launched a new online portal as another way to get on the waiting list. He says people will only be contacted when it's their turn, but warns
it could take several weeks to even longer, given our supply, to get that phone call back.
Regarding the sign-up issues, we asked Samuel why the infrastructure wasn't in place ahead of the move to 1B and if this was on the local or state health departments. Samuel says part of it was the speed at which Virginia opened up 1B eligibility, and it was his understanding when they got to this point it would be more than just local health departments handling the load. He says Chesterfield isn't alone in facing these problems, and while others may have gotten organized quicker, it is now in place.
So beyond that, yes, I think some of the state structures that could have been more robust simply weren't there as well for the very same reasons as far as the accelerated pace.
So, are you saying that they opened it up too much too soon?
Yes.
We asked Samuel if that was on Governor Ralph Northam for making that decision.
Let's just say it was for myself, and I would say many of my colleagues, a surprise and a heavy lift.
Now, we reached out to the governor's office about Samuel's comment, and a spokesperson wrote back saying in part that each health district was supposed to move into Phase 1B when they were ready, and that the need to build up district infrastructure was specifically why they didn't do a statewide move such as was done in Maryland, and left it up to the health districts and directors themselves. Now, one other thing for the Chesterfield Health District is we're next to the fairgrounds in Chesterfield County, where there was a closed vaccination event today, and we've been getting a lot of questions about what was going on. And the district says that, again, this was a closed distribution for people in Phase 1A and 1B, and they did have people showing up who did not have an appointment for today. And they say when people do that, that slows down the process for those that do, and say there will be future events here, but people will get contacted by the health district if they have an appointment. And they say if you do have an appointment, don't share that information with others. And if you don't have an appointment, to not show up at these events without one. Working for you in Chesterfield County, Cameron Thompson, CBS 6 News.